morning. This is TTT Live. I'm DK Roster. We are currently standing by for a press conference hosted by the Ministry of Health. We're bringing you live coverage on TTT and Talk City 91.1 FM. And remember, you can stay up to date on Facebook, Twitter, Instagram, and YouTube at TTT Live Online. Now, as we said, we're standing by to bring you coverage of that live conference. The information coming to hand between the conference yesterday and today is that there is now a total of 57 persons testing positive for COVID-19 in Trinidad and Tobago at this time. Now, case 1 has a history of recent travel. Case 2 is known to have had contact with a person with a history of recent travel. And yesterday, Dr. Avery Hines actually spoke about the difference between community spread and primary contact. Now, 3 and 4 are 2 additional nationals who returned from a cruise but entered the country separately from the group of 68 nationals who returned from the same cruise. The Ministry of Health advises the population that the alleged fake news post referring to videos of Alleyne was not issued by the Ministry of Health. That may also be something that is addressed in the press conference. But while we're still waiting for it, we are here to give you the latest statistics as indicated by the World Health Organization. Now, globally, there are 372,757 confirmed cases of COVID-19. Now, this is happening worldwide in 189 countries with 16,231 deaths. 4 new countries in Southeast Asia and 1 new country in the Americas have reported cases of COVID-19. The WHO risk assessment at the global level remains very high. Back at home, TSTT's CEO, Dr. Ronald Walcott, says the company has a 6-point plan to deal with customers' communication needs during the COVID-19 outbreak. Dr. Walcott also states in a media release that TSTT has ensured uninterrupted service to areas such as Cora, Couva, and Balandra, where COVID-19 quarantine treatment facilities are located. He adds that TSTT has enhanced their network to deal with a surge of activity brought on by greater numbers of people at home. TSTT also intends to keep citizens up to date with the latest news and prevent the spread of fake news through additional monitoring of their network. Among the other initiatives announced, TSTT intends to provide free data to the underprivileged, providing solutions for work-at-home strategies, and ensuring the company's employees can work from home and maintain social distancing. And we will not actually speak to Julius Gittins as yet, but in Barbados, the government has confirmed no new cases of the COVID-19 virus as of yesterday. The Ministry of Health and Wellness announced yesterday that the 11 persons tested on Sunday were all negative for COVID-19. This means that the number of positive COVID-19 patients in isolation in Barbados remains at 17. Now, as promised, we here at TTT are committed to sharing information to help you function in this new normal. Today, we look at the efforts of JTA supermarkets. Now, JTA has instituted measures that aim to serve their regular customers at all 5 locations. This is in addition to special measures for the more vulnerable as well as essential care providers. Now, all 5 locations now accept TT food cards, with the C3 location coming online. There are now checkout registers reserved for senior citizens / differently abled persons as well as essential care providers. Now, doctors, nurses, as well as police and fire officers must be in uniform or present ID to access this feature. Most branches will open earlier from 7 to 8 a.m. to facilitate elderly and differently abled customers. But from 8 to 11 a.m., additional staff will be on hand to assist with actual shopping and grocery pickups. Simply walk with your list and present this to branch management team. Now, during all of this, there's now a standard practice of dispensing hand sanitizers to customers as well as wiping down trolley handles. JTA has also been active on their social media platforms, sharing their new policies as well as the information from the Ministry of Health and World Health Organization. So we say thank you to that. Reminding you, we are standing by to bring you live coverage of a press conference which will be hosted by the Ministry of Health. We're doing so live on Talk City 91.1 FM as well as TTT Live Online on Facebook. So thank you for actually tuning in already, and thank you for staying with us. Foreign Affairs and Health Ministers of 33 Association of Caribbean States are working on a joint regional response to tackle the deadly pandemic COVID-19. The minister's chief medical officers and other functionaries shared their national responses and concerns at a meeting in Port of Spain. ACS Secretary General Dr. June Suma said information sharing must be the first step in battling COVID-19, and she called for the sharing of best practices in the region. Cuban Minister of Foreign Affairs Bruno Rodriguez said Cuba offered some cooperation in the regional efforts to defeat the virus. He added that the Caribbean must not underestimate the value of joint effort and must carefully consider the impact of COVID-19 on vulnerable groups. Meanwhile, Executive Director of CARFA, Dr. Joy St. John, urged the region to focus on governance in this global crisis as there is no known treatment for the virus. On the international front, Prince Charles, the heir to the British throne, has tested positive for coronavirus, according to palace officials. A palace statement said Prince Charles has been displaying mild symptoms, but otherwise remains in good health and has been working from home throughout the last few days as usual. The spokesman said his wife, the Duchess of Cornwall, has also been tested but does not have the virus. The royal couple are now self-isolating at home in Scotland. The statement added it is not possible to ascertain from whom the prince caught the virus, owing to the high number of engagements he carried out in his public role during recent weeks. Asia's largest democracy is on the first day of its lockdown. The government of India announced the measures yesterday as travel restrictions in some parts of China are being lifted. Vidya Ramphal has more.
The Health Ministry of India says India has 519 COVID-19 cases and 9 deaths. The country has a population of 1.3 billion people, but very low testing rates could be to blame, making it a possible pandemic hotspot. Meanwhile, in China, Hubei province is lifting all of its travel restrictions today. This is a significant milestone for 60 million people who have been locked down since January. Wuhan, where the global outbreak began, will ease its restrictions on the 8th of April. Across in South Korea, officials there said that all arrivals from the U.S. would need to self-isolate for 2 weeks from Friday. South Korea's imported cases have jumped from 34 to 101 on Tuesday, its biggest single-day rise as it battles a second wave of infections. European arrivals already face a 2-week quarantine and virus tests. Malaysia, meanwhile, is extending its 2-week lockdown. With just under 1,800 confirmed cases, the country is the worst hit in Southeast Asia, recording 17 virus deaths. Pakistan, which has 991 confirmed cases and 7 deaths, said it has recorded its first corona death due to local transmission. The Lahore resident had no travel history. In Central Asia, people in Uzbekistan face fines for not wearing masks in public, and Kazakhstan's main cities are under quarantine. Finally, Turkmenistan says it is yet to record a single case. The Central Asian country is one of the most secretive states in the world. Vidya Ramphal, TDT News.
Thank you for staying with us. Remember, we are standing by to bring you live coverage of our press briefing from the Ministry of Health, and this will be live on TTT Live Online on Facebook, as well as Talk City 91.1 FM. Now, on the sporting front, COVID-19 continues to wreak havoc, yesterday forcing the Olympics to be postponed. Rescheduling Tokyo 2020 is like a huge jigsaw puzzle, and the new date will not be restricted to the summer months, says the International Olympic Committee's president. It was announced on Tuesday that the Olympic and Paralympic Games will have been delayed until next year because of the worldwide coronavirus pandemic. Thomas Bach said there are many thousands of questions to address before a new time frame can be confirmed, but added that all options are on the table. Explaining the sequence of events that led to the postponement, Bach said the International Olympic Committee received an alarming update from the World Health Organization, but the final decision could not be unilateral. Speaking on a conference call, Bach said a special task force named Here We Go has been set up to tackle the logistics of reorganizing Tokyo 2020. FIFA and the World Health Organization have teamed up to combat the coronavirus or COVID-19. Their new awareness campaign, led by world-renowned footballers, call on all people around the world to follow 5 key steps to stop the spread of the virus. The Pass the Message to Kick Out Coronavirus campaign promotes 5 key steps: hand washing, coughing etiquette, not touching your face, physical distance, and staying home if feeling unwell. Lionel Messi, Yaya Toure, Alison Becker, and Carly Lloyd are among the 28 players involved in the video campaign. FIFA President Gianni Infantino says we need teamwork to combat the coronavirus. Manchester City manager Pep Guardiola has donated €1 million to fight the coronavirus outbreak in Spain. Guardiola, who is at his home in Barcelona, has been working with his lawyers over the past few days to work out the best way of using the money. And we now stand by. Remember, we are standing by to bring you live coverage of the health conference. And we are actually looking at some of the things that are happening. We see individuals coming up, stepping onto the podium, getting ready to take their places. And we will be looking for one of, we've already outlined some of the points that they may be speaking on. We see the Ministry of Health, Terrence Deyalsingh, the Minister of National Security, Stuart Young. We are also looking at some of the other individuals who are there. We see Minister of Social Development, Camille Robinson-Regis. And some of the things that we're speaking about, there are 57 cases already. This is as confirmed. Now, we have 4 additional confirmed cases of COVID-19. Now, this, as said, brings us to a total of 57 persons testing positive for COVID-19 in Trinidad and Tobago at this time. Case 1 has a history of recent travel, as well. Case 2 is known to have had contact with a person with a history of recent travel. Cases 3 and 4 are 2 additional nationals who returned from a cruise but entered the country separately from the group of 68 nationals who returned from the same cruise. Now, the Ministry of Health advises the population in another point that the alleged fake post news, they may actually speak to that, but we take the opportunity to cross now to Donna Cox, the Minister of Communication.
Good morning, and welcome to today's media conference to update you on the government's efforts to combat COVID-19. I have with me today the Minister of Health, the Honorable Terrence Deyalsingh, the Minister of National Security, the Honorable Stuart Young, the Minister of Social Development and Family Services, the Honorable Camille Robinson-Regis. Also with us is the Chief Medical Officer, Dr. Roshan Parasram. Before we get started, I would like to inform you that the government is working on a solution and will soon be having virtual media conferences. We recognize the inherent risks of having everyone gathered in this room. Therefore, we would like to ensure we not only talk in social distancing, but we demonstrate it. My office will be in touch with media houses about how this will work. We have tested it already at the ministry, but we would like to test it with you, the media. This is to ensure it works as well as this face-to-face media conference. It will indeed require your cooperation, but we are asking that you work with us as we leverage technology to beat COVID-19. I will now start with the Minister of Health.
Thank you very much, Minister Cox. Good morning to ladies and gentlemen of the media and citizens of Trinidad and Tobago. As we continue to reach out via the media to keep the population informed, educated about how the government is dealing with COVID-19. As you know, COVID-19 is a global pandemic, and we are one of the over 150 countries around the world affected by it. Let me just give you a quick update on where we are with testing and samples. To date, as I speak now, we have tested 370 samples. Of that, we have 60 positive tests. Of those 60 positive tests, it must be emphasized that 41 of those 60 tests have come from one source, that is, those individuals who went on the cruise, which thus leaves us with about 3 tests which were positive from those cruise ships passengers who came in before. Therefore, it means that of that, we have very limited exposure to possible community spread at this point in time. We must put those 60 positive tests in context that the vast majority have come from one source, that is the cruise ship. 44 from the cruise ship, which leaves, I believe, then 16 in total. Whilst that is comforting news, it should not lead us to let our guard down. We have to continue as a country listening to the Prime Minister, the Honorable Prime Minister, myself, the CMO, Minister Stuart Young, to do two things. And today I want to stop using the term social distancing because I don't think people are understanding what social distancing means. Social distancing just means stay apart. Let's boil it down to that. Social distancing means stay apart. And I'll give you an example. The banks are doing everything when they allow people into their banks to keep you apart. But what is happening outside of the banks is that people are congregating in 20s and 30s. That is not social distancing. So let's just keep apart. Keep apart. The other term I want to start to change in how we use it is, what does isolation mean? What does quarantine mean, especially for the 20,000 odd people who have come into the country before our borders were closed? It simply means stay home. It simply means when you stay home, stay in your own room, your own space, as far as humanly possible. So I'm trying to break down two terms that the lay person could understand. So social distancing simply means stay 3 to 6 feet apart. It makes no sense to apply it inside the banquet hall, but then you are outside on the pavement and you are bunching up together in 10s or in 20s. The other thing I want to emphasize is that we have set up the hotline for the members of the public with your genuine COVID concerns. Please make use of it, 877-WELL. I want to take this opportunity now to put in context how we are dealing with our COVID-19 pandemic in Trinidad and Tobago in the context of what you are seeing around the world, where hospitals are running out of PPE and people are asking hospitals to reuse PPE. We are not there yet. We are in a good place, but it just takes one or two irresponsible individuals to spread this thing widely. And as I said, this hard-won victory that we have could evaporate. I just want to tell the media and healthcare workers in particular what the government has done to secure your safety. N95 particulate masks, we currently have 37,000 in stock. We are not asking anybody to reuse masks. We have an incoming shipment of 26,000, and I must thank now UNDP. They are going to be giving us 175,000, and PAHO in 2 tranches will give us another couple 100,000. We are going to end up very soon with over 1 million N95 particulate masks for our frontline people in the health sector, whether it's army, police. So I want to put that out there, that yes, we're in a global pandemic, but little Trinidad and Tobago has sourced more than enough N95 particulate masks for our frontline workers, our doctors, our nurses, ambulance drivers, ward attendants. We are in a good place. However, don't take this for granted. As far as goggles are concerned, we are going to be having, and we received it, 1,000 from the People's Republic of China. And we are so grateful. Minister Young and myself just left a handover ceremony for thermal scanners and so on. The People's Republic of China has given us 1,000. We have 10,000 coming in, and we are going to have a total of about 25 to 30,000 in the system, which is more than enough to protect our local frontline workers. As far as gloves are concerned, we have 13 million gloves in stock. Let me repeat that. 13 million. Again, a very fortunate place for us to be. Disposable gowns, we have 150,000 on hand. Incoming shipments will lead us to a total of 500,000. So we will not be reusing. Our healthcare workers are well taken care of. Shoe covers, we currently have 23,000 in stock. Incoming shipments, 450,000. And head covers, we have 180,000 in stock. I say this to you not as a boast, but you have to understand global supply chains have been disrupted. And we are in a very fortunate position to have these in stock and coming in to protect frontline workers. The last issue I want to deal with is how do we as a national community respond in a time of crisis? In a time of crisis, there must be unity of purpose, unity of command, and unity of communication in how we deal with this. There must be a focal point, a central point, to give the media and give the population clear, consistent, accurate, timely information. Because if we don't, the alternative is chaos, confusion. In matters of health affecting this beloved Twin Island Republic of Trinidad and Tobago, and on a national level, such as this COVID-19 pandemic, I, as Minister of Health, representing the central government in this, aided by the Minister of National Security and the Chief Medical Officer, we would benefit from unity of communications. And we are under the expert advice of the Chief Medical Officer and I, as Minister of Health, representing the central government's position. The Chief Medical Officer is the principal advisor to the government of Trinidad and Tobago on health matters. And I, as Minister of Health, will take that advice, marry it with my colleague, the Minister of National Security, and take that advice up the chain of command to the Cabinet and to the Prime Minister. It is because of this the Minister of Health will be the focal point for any communications coming from, for example, testing for CARFA pertaining to this pandemic. The four regional health authorities in Trinidad and Tobago and the one in Tobago continue to provide critical public health delivery services to the population under the guidance and direction of the central government, represented by the Chief Medical Officer and the Ministry of Health. I say this because CARFA is being bombarded by members of the public to release test results to them. That is not going to happen under my watch as Minister of Health. Any test results will go to the Chief Medical Officer and the Ministry of Health in their daily updates at 10 a.m. and 4 p.m. will be giving you those updates for the Twin Island Republic of Trinidad and Tobago. We are one country under God. We are one country fighting a global pandemic. So with unity of purpose, unity of command, and unity of communication, we will keep the national community informed of all relevant developments as we move forward. So these were the three issues I wanted to raise this morning. that we have enough stocks of PPE. We're in a very good position. It's a hard-won victory, but let's not squander that by being irresponsible. I wanted to just convey and translate what social distancing means. It just means keep apart. Whether you are within the bank, outside the bank on the pavement, and a final plea to the 20,000 odd visitors who have come in over the past 14 days. Isolation and quarantine are just big words that simply means keep to yourself as far as humanly possible. Don't go out. Don't go to work. Don't go to the mall. Don't go in a maxi taxi. Don't go to the grocery. It means keep apart from the rest of your family. That will limit community spread. And we have the hotline which we have set up for your benefit. And if we do this, these simple measures, as I say, I promise Trinidad and Tobago, we will get through this very difficult time and we'll come out at the other side of the tunnel a stronger people. Thank you very much.
Thank you very much, Minister. I'd now like to call on Dr. Roshan Parasram to give an update.
Good morning, honorable ministers, members of the media, members of the listening population. So just to take off on the point that Minister ended, we had spoken about the 20,000 persons in our population that came through our borders within the last 14 days, which represent 0.015% of the population of Trinidad and Tobago. The great majority of you, and I've been getting reports, are staying at home and doing the responsible thing. It does not take a large number of people to doing the irresponsible thing to spread this disease to all of us. So what my committee has been doing, the Interministerial Committee, in particular the Trinidad and Tobago Police Service and Defense Force, as well as the Immigration Division, they have already sent to me a listing of most of the persons that have come through the borders within the last 14 days. We have actually put that in an Excel format. That has gone from my office to the Trinidad and Tobago Police Service as well as the Defense Force. And under the Quarantine Act, the Police Service is actually actively monitoring all persons at this time. And if persons are found errant under the Quarantine Act, we will actually use the Quarantine Act to do three things. If needed, we will impose quarantine in a facility if it is required, whether it be a hospital or it be another facility of the government's choice. We will impose stricter quarantine if need be with police around the clock around your homes. Or we can impose fines, which are fines that we have said before, 6 months imprisonment if required, or $6,000 as the need be. So we are pleading, but we are in the process of actually ramping up our monitoring via the Trinidad and Tobago Police Service and the Defense Force to ensure that the persons stay at home. So I think we are at the tipping point, and we would have seen recent examples in the press that would have shown how irresponsible some of us are being. If we do not abide by the Quarantine Act, we will have no choice but to use the full force of the law to get persons to stay at home. So we are pleading with you once more. So with regards to returning nationals, as the Minister of National Security has said, the borders are closed now. The Minister of National Security has authority to allow persons in. Even if and when that occurs, when the epidemic subsides in various regions, persons coming back to Trinidad and Tobago will also be quarantined for a further 14-day period based on the Quarantine Act to ensure that there's no risk of infection to the rest of the population. Yeah.
Thank you very much, Dr. Parasram. At this time, I'd like the Minister of Social Development and Family Services to address us on the social support offered by the Government of Trinidad and Tobago.
Thank you very much, Minister Cox. Good morning, colleague ministers, Dr. Parasram, members of the media, members of the listening and viewing public. Thank you very much for this opportunity to again indicate what the measures are, and really to take this opportunity to indicate that we empathize with those persons who have lost their jobs or who are now in a very confused state because they are not sure exactly what to do or where to go. And I realize that that is why people have been crowding the offices of the social welfare, and also the NIB and several other offices. We understand what you're feeling, but we will not get through this together if you crowd the offices. We do empathize, we do feel sorry about what may be happening to you now, and certainly the uncertainty that you're experiencing. But we're trying to make sure we do everything to assure that each person who needs assistance receives the assistance. So please do not crowd the offices, because as my colleague, the Minister of Health, has been saying, and Dr. Parasram, and my colleague, the Minister of National Security, has said, crowding can create some difficulties for us. So do not crowd the offices. What we are doing at social welfare, we are putting customer service representatives at the offices who will deal with you specifically. Let me make the point that the persons that we are dealing with specifically at this time are those persons who may have been retrenched, terminated, or got a reduction in their salary because of the current circumstances. And I mean circumstances that may have begun from March 1st. And that will include persons such as were spelled out at the businesses that we talked about in the public health order. And let me just repeat. We are talking about persons who may have worked at a bar, either licensed or unlicensed, and are not now working because that bar is closed. Persons who were working in a club, and that club has been closed, you are the person we're talking to. Person who worked at a theater, persons who worked at a cinema, persons who worked at a gaming house or betting office. Those are the persons that we're talking to, persons who may have been working in a restaurant that is now closed, and so you are no longer employed, or you may be getting a reduced salary. Let me say two things to those people. One, the NIB will be dealing with those that belonged to a registered business and you were getting NIS. But the NIB is not yet ready, because the Minister of Finance did say that the guidelines will be out in 7 days. So please do not go to those offices. They are not quite ready. Secondly, with regard to those of you who I just listed, who may have been employed and were not getting NIS, or you may be self-employed and were not paying NIS, but you find yourself in this position where now your business is no longer operating, the Ministry of Social Development will deal with your issues. As I said, in every area where we have an office, we are putting customer service representatives there, but please try not to crowd the offices. We will deal with each and every one of you. In addition to that, with regard to those persons whom I just spoke about, the Ministry of Labor has opened an online portal where you can submit your information, so you do not have to come to the offices for that. If you do feel you need to speak with someone, we have the customer service persons who will be there in place from tomorrow at each office. They will be having a special desk. So you're just going to go to those people, but you're not going to crowd the offices. Let me repeat. We understand that you're anxious. We are also sharing in your angst. And that is why we have put these packages of this social package in place to ensure that we can deal with you. We have 10 offices throughout Trinidad, and we have offices in Tobago. So we will be dealing with you. We know what we're doing. We understand what you're going through, but it is not helping you or us if you crowd the offices. So I hope I've made that clear. Let me repeat what I said before with regard to the food card for children who are on the school feeding program. There are children registered on the school feeding program that is conducted throughout the education system. Only the parents of children who are registered to receive school feeding will be given a food card once you are not already in receipt of a food card. Let me repeat that. Once you are not already in receipt of a food card, you are entitled to get a food card if your son or daughter was registered with the school to receive school feeding. These food cards will be given out by the MPs. However, it is from a list that is already prepared, a list that we got from the Ministry of Education. That list in the main has telephone numbers. The MPs will have possession of the list, and the persons who live in their constituency will be called by their offices because the list in the main has telephone numbers of parents. And you will come to the MP's office when you are called. So I hope everybody understands that. With regard to persons who now are in possession of a food card, those persons will receive in their April food card a top-up of their food card. And that top-up ranges from $150 to $450. And it will depend on the value of your card. In April, you will get all 3 months at the same time in the top-up. With regard to persons who have been recently retrenched or terminated or have their income has been reduced, they are also entitled to receive the food support, and you will receive a card of $510, and you will also get $510 each month for 3 months. We are asking that the persons who are on public assistance and disability assistance, we are indicating again that you will also receive an extra support in your normal way. So if you normally receive your public assistance or your disability assistance grant through a direct deposit, that is a deposit to the bank, you will see the difference in your bank because you have a card and you will see that there's more than you normally get. Those of you who receive it by check, the check will come in the normal way, and you will see in the middle of March, you will get, in the middle of April, you will get an extra check, which will be the 3-month top-up. Let me move now to income support for current beneficiaries of the public assistance grant and the disability grant. Those persons who are receiving that kind of support, you will see the changes in the amount you get for a 3-month period all together. We also have a grant for persons who pay rent. Rental assistance, if you have been now on a reduced income, you have been retrenched, or you have been terminated, we have rental assistance of up to $2,500 per month in accordance with the established policy of the ministry for an initial period of 3 months. If this continues, we will give you that same amount, $2,500, for another 3 months. However, if it continues beyond that, that assistance will be given for another 3 months in the order of $1,500, and if it continues beyond that, you will get assistance in the order of $1,000 for a further 3 months. With regard to the socially displaced, we have said that working with the Ministry of Health, the Trinidad and Tobago Police Service, and the Ministry of Social Development and Family Services, that we are instituting the Move Along policy, and that is a policy where we move the socially displaced to the already established NGOs that deal with these people. In these circumstances, we're trying our best to ensure that we do get our socially displaced off the streets and into these homes. The issue is that there is a subsisting judgment that says that according to their human rights, we cannot just pick them up off the streets. So I hope the population remembers that and understands that. So we have to use moral suasion. Let me also say that once they go to these places, we will be giving these NGOs additional financial support to ensure that they can provide meals for their additional charges. Ladies and gentlemen, I want to just reiterate that we understand the angst that you're going through. We understand that this is a very uncertain time, not just for you who fall within the clientele of the Ministry of Social Development and Family Services, but for all of us in Trinidad and Tobago. But once we follow the guidelines and do what we're supposed to do not crowd the offices, do not rush to the offices, just go in the normal way. I know you're nervous, I know you may be frightened, and we understand the situation. But in order for all of us to get through this together, we have to work together. We know you're anxious, but please, we have the ability to take care of you, and we will do that. We're sorry that we all have to go through this, but we are ready to take care of you. But you need to work with us at the Ministry of Social Development and ensure that you do what you're supposed to do. Let me say that all the guidelines for accessing our services, that is the guidelines and the forms, will be available from 4 o'clock this afternoon on the websites of the Ministry of Social Development and Family Services, the Ministry of Labor and Small Enterprise Development, and on the website of TT Connect. We also have our hotline, and those numbers will be made available to you. So thank you very much, and we understand. So we know you're nervous, we know you're frightened, but we have things in hand and we'll take care of you. Thank you.
Thank you very much, Minister of Social Development. May I add that all the information will also be available online on the pages of the Ministry of Communication. At this time, I'd like to call on the Minister of National Security.
Thank you very much, Minister Cox, my cabinet colleagues, Minister Deyalsingh, Minister Robinson-Regis, members of the media, wider viewing and listening public of Trinidad and Tobago. This morning, I've been specifically tasked to deal with a number of items that are affecting us today. First, I'd like to start off by assuring you that all of the measures that the government has taken and will continue to take, especially at this stage, are to protect the persons here in Trinidad and Tobago. This virus, as surely by now we've all realized, respects no boundaries. It respects no races. It respects no nationality. It respects no religion. It respects no age. It respects nothing that is human. The virus is a highly contagious one that we have seen spread across the whole globe, and we in Trinidad and Tobago are not immune from it. The Chief Medical Officer gave a very important message a short while ago, and I'd like to just refer to it briefly. He said we are at the tipping point, and that is a very important message that he gave us. The reason that the government took to close our borders is because we want to protect everyone who remains here in Trinidad and Tobago. The closure of our borders brings us absolutely no pleasure, but it is specifically been done at a fairly early stage compared to a lot of other jurisdictions that are now crumbling under the runs on their healthcare system to protect you, the persons here in Trinidad and Tobago. If persons find their way through this border, whether it be via action, including court action or not, understand that it is going to affect everyone. Understand that at this stage, as the CMO and the Minister of Health and the other healthcare professionals have told us, the cases are all imported cases. Persons returning to Trinidad and Tobago, especially through international airports, present those risks to us. And that is what we are now seeing manifesting themselves around Trinidad and Tobago. So far, all of our exposure has been from people returning from abroad. Hence the reason to close our border, and to close our border in a very short time frame. Not a time frame that suggests, well, give until Tuesday, give until Wednesday. The government took the decisive action to close the border to protect all of us here in Trinidad and Tobago. What we are asking our citizens who remain across the globe in certain positions is take shelter where you are. Take shelter where you are and focus on your self-preservation where you are and looking after yourself. Reach out to our various embassies, consulates, etc. that we have across the globe. Let us know where you are and let us see what can be done where you are. If we have to open our borders, understand that is the end of hope from a medical perspective. And that is a very important message. Understand that if the borders are opened, it now puts all of us remaining here in Trinidad and Tobago at considerable risk. We have seen the suggestion and the threat of going to court. That is not something that the government takes lightly. And I dare say that is not something that the population takes lightly. The persons who are currently in Barbados, we understand is about 33 persons, took very calculated decisions to leave where they were after our borders were closed in Trinidad and Tobago and to attempt to make their way back. The borders were closed to protect all of us. They made their way to a sister Caricom country, Barbados. Before they left Oman, before they left South Africa, to Oman, Oman to London, London to Barbados, they were aware that our borders would be closed and they would not make it back in time. Barbados has implemented a 14-day mandatory quarantine period. We went a step further and closed our borders to non-nationals and then now to nationals as of midnight on Sunday. And I emphasize again, to protect the remaining population here in Trinidad and Tobago. Every single country, and we're seeing it in the United States in certain states, has limited bed space. And what we need to do is to flatten the curve and keep the curve as flat as we can. We've heard from the Minister of Health and the Chief Medical Officer the daily effects that imported cases are having here in Trinidad and Tobago. If the court was to order that persons be allowed in, that would be the end of the protection that the government has very carefully put in place to protect people in Trinidad and Tobago. And it would defeat completely the closure of our borders. We are in contact with our Caricom sister Barbados. We will continue to have conversation with them. We thank them for their 14-day quarantine period. And what I'm going to say here now with respect to those specific cases, and the only case there, is if those persons, after their quarantine period in Barbados, do not present any symptoms of COVID-19, the coronavirus, and they make their way to Trinidad, they will be put into quarantine by the state. We need to keep our border closed and to continue to protect all of you, the population who are now within our borders here in Trinidad and Tobago. Understand that it cannot be a loophole that we accept that persons make their way from wherever they are in the world on the few remaining international flights to any CARICOM country, including Barbados, and then think that that is a jumping point to break the barrier that we've put to protect the population of Trinidad and Tobago and the people within our borders. The government is resolute that it will not allow that, and it will do all that it can to continue to protect you, the population that are here. Once a CARICOM border is open with access to Trinidad, we have no more border protection. If we leave this open, any person who is sick can go on a plane in the United Kingdom, head to Barbados, and because Trinidad and Tobago is closed to protect us from this situation, they can then attempt to get through our border like this. The government is resolute that we will continue to protect the population, and we're not going to permit that. After seeking advice, and you heard the Chief Medical Officer say it a short while ago, if these 33 are provided with an exemption, once they don't present with symptoms within the quarantine period in Barbados, and we're not going to be bringing them home, if they present here in Trinidad, they will be quarantined by the state for another 14 days to protect the population. I want to repeat that the virus knows no boundaries. The virus does not care who we are as a population. We're seeing it happening all over the world. Persons who we may consider celebrities, persons who we may consider privileged people, getting the virus, and the same happens in Trinidad. We took a decision to close our borders. We took a decision very early o'clock and have been taking decisions to protect people. And that is one of the positions of the government, and we will continue to do so. Even though we've closed our border, it appears as though there's some people in our society who continue to want to put the rest of us at risk. The rest of us who are exercising our social responsibilities at risk. There's certain irresponsible people who continue to want to push the boundaries. The boundaries are not boundaries pushed on the government, are not boundaries pushed on the CMO, but those are boundaries pushed on we, the population of Trinidad and Tobago. So those irresponsible people who continue to want to threaten our survival as a country and our success in protecting you, the people of Trinidad and Tobago, we will not permit that to happen. We will do everything within our power and reasonable to not permit that from happening. We will not be using CARICOM airports to defeat our entry. It is either we are in or we are out. And that is a clear message today. It is even more dramatic and dangerous to us here in Trinidad and Tobago when CARICOM countries continue to have that international travel with the threat to then catapult them into Trinidad and Tobago. And the government is resolute that that cannot be permitted because we need to protect all of us here in Trinidad and Tobago. There is some misinformation being carried out there, particularly on social media. With respect to the persons who are in Suriname, on Saturday, I, as the Minister of National Security, gave very clear instructions very early in the morning on Saturday night and very early in the morning, at 3 o'clock in the morning on Sunday, to Suriname Airways that they could bring our nationals home because we had not yet locked our borders. Suriname Airways was unable to carry their flight on Sunday before we closed our borders because they could not get a crew to fly their plane. So the suggestion that the government of Trinidad and Tobago somehow prevented it is completely untrue, and I'd like to correct that. We gave all permission. I ensured that our permanent secretary at the Ministry of National Security reached out to Suriname Airways directly and told them I'd granted permission for them to come and bring our citizens from Suriname home before we closed our borders. Suriname Airways could not get a crew. I was just informed by our embassy in Venezuela that so far it is 17 people that they've located, 16 in Margarita and 1 on mainland Venezuela. So they're dealing with the number of 17. As I said earlier, any of our nationals anywhere in the world, please contact our embassies or high commissions, this type of thing. But understand that our decision to close our border remains. How we deal with these 33 people in Barbados, as I've said, let them complete their quarantine, and then we will consider, but we are not sending for them. And if they come here, they will be quarantined again for 14 days by the state. The important point that the Chief Medical Officer made to us in advice is once you enter an international airport, once you go on an aircraft, you are now presenting yourself to fresh risk. So you can go through all the quarantine in the world. You enter an airport and you enter onto an international flight, you are now back up to maximum amount of risk. Look at what is happening in the state of New York. Look at what has happened now in New York City, which leads to my final point, what the CMO touched on about using the Quarantine Act. Persons who have traveled to Miami, to New York, to all of these international airports need to self-quarantine. Moving around, as we've seen happen, by personalities, that has led to serious contact spread risk. It does not respect, the virus does not respect our status or what perceived status you may think you have in society. To say that you don't think this could have happened to you when you've tested positive is of no use to all of the people that you have put yourself into contact with when you should have been self-quarantined. We are going to be taking very strong positions with respect to that. So please, population of Trinidad and Tobago, be assured that the government remains resolute in doing all that we can to keep our borders shut. And the threat of court action means nothing when you allow persons to break your borders and to now infect via importation the rest of us here in Trinidad and Tobago. Our system, our medical healthcare system, and I take my hat off and I give salutations and high respect to the Minister of Health, the Chief Medical Officer, and all of the personnel who have been working. I was retracing it since last night, since before December when this started. The Ministry of Health has been working to build that parallel healthcare system and have done a tremendous job. But as you saw with the return of the persons from one cruise ship, now 44 persons are taking up those bed spaces. Understand, every person who imports right now from an international airport on a plane adds an additional risk. And I will say this without fear of contradiction. Persons, if they are allowed to penetrate our borders at this stage, because right now we don't know with any certainty what we're dealing with within our borders as more cases present, can very quickly overwhelm our medical healthcare system. The same way you're seeing happening now in the mighty United States has happened in Italy and other countries of the world. Pay heed to what's happening in the United Kingdom, United States, as we as a globe join hands with everyone in the fight against, not literally, in the fight against COVID. We will continue to protect you by keeping our borders closed. Thank you all very much.
Thank you very much, Minister of National Security. At this time, ladies and gentlemen, we are open for questions. Please identify yourself and media house first.
Good morning, Akash Samaru, CNC3. Good morning, ministers. Good morning, Dr. Parasram. Now, it would be absolutely remiss of me to not ask about one Alleyne, who woke up the country last night by saying that he's tested positive for COVID-19. What can you tell us about that? Now, I understand patient confidentiality, but those who have been in contact with him are panicking, and even our own colleagues and co-workers who would have shared a space with him recently are concerned.
So as you said, patient confidentiality takes precedent. From the first case going onward, we have not shared the identity, the actual place that persons live, and we can't do that, and we will not do that going forward. However, for anybody that has been in contact with someone that they think is suspect or confirmed, they need to contact our 877-WELL number, any of the CMOHs or any of the health centers at their earliest point, and of course, self-quarantine while you do so.
Okay, so you're advising everyone who has been in contact with him since he returned to self-quarantine?
No, we're advising two things. And that's why we set up the hotline, because I have been getting calls 1 o'clock, 2 o'clock, 3 o'clock this morning. So the Minister of Health is not the hotline. We set up a hotline, 877-WELL. Anyone who thought they were in contact with any COVID-positive patient, regardless of status, regardless of geography, that is the purpose of the hotline. You call the hotline, you will be asked certain questions. The doctors who man the hotline will then make the decision as to your potential level of exposure and advise you what are the next steps to safeguard your own health.
I'm glad you said that because, looking at Mr. Alleyne last evening and he was talking about going to get himself tested, that is something that you would like to heavily discourage.
I would like to encourage everyone to use the hotline in a responsible manner. And let me just close off the discussion about a personality. There's something called a patient charter of rights. Any patient, regardless of status, socioeconomic status, profession, whatever, they are entitled to patient confidentiality. Members of the media, you have called me over the past 4 years to discuss what a patient tells you all in the public domain. And I always say, I have to take the hit for these unsubstantiated claims because patient confidentiality reigns supreme. The day I, as Minister of Health, break that sacred rule, I become a threat to the healthcare system. And I would not even wait for the Prime Minister to fire me. I will resign if the day I mention anything about any patient in the public domain. Patient confidentiality is the bedrock of a health system, and I take it very, very seriously.
Akash, if I may, from a national security point of view, this is of serious concern. And use this as an opportunity and an example to us all of how contact spread really works. Because it is real and now amongst you all from the messages that I have been getting. And how one person being irresponsible can be in contact with all of us in this room and we don't even know. And for extended periods, you are just doing your job. You are being sent on assignment to do your job. I've seen you wearing your suit, etc. And all of that could be defeated by the irresponsibility of persons who have traveled, then saying, well, I'm feeling well, let me go out there. And that is why it's a mandatory quarantine period of 14 days for certain high-risk people. And that is why we were doing what we did with those who came back from cruises. But you don't have that opportunity with everybody. So persons who have traveled, and this is now a live example amongst you all, and with that level of exposure.
Hi, Nika Pasanal from Loop TT. I'm just wondering, what are the repercussions, if any at all, about spreading misinformation with regards to COVID-19, especially claiming to be infected with it?
about spreading misinformation. We very early in our conversation with the nation, we said that misinformation is one of the worst things you could do to traumatize a nation right now, and we strongly condemn it. We set up a protocol, a government policy that the Ministry of Communication and the Communications and the Ministry of Health would drive all of the government's official communication on COVID-19. That continues to be the position from a responsibility point of view. Spreading misinformation is something that you're creating panic amongst the population. And we're seeing how the population are reacting to it. I don't know the particular instance you're referring to. This one, I think the Chief Medical Officer and the Minister of Health have done a fantastic job in avoiding the breach of patient confidentiality. What I am saying as the Minister of National Security, and I'm driving a very careful message, I am not talking about misinformation here. I'm talking about a real live situation amongst you all and amongst us that has presented itself. Read in between those lines.
Another question?
Drew Brown, TV6 News. Just one or 2 points of clarification. I don't know who could answer, but let's say for any business that has been affected by the economic impact of COVID-19 and has had to close operations, send home workers, what is the legal responsibility in terms of the employer? Because the state is looking at helping those workers. But does the employer have a responsibility to at least pay a month's salary? Because you're hearing some people may be sent home without being paid by the employer.
All right. The government, the Minister of Finance has spoken to that. There are two areas where the assistance, if it qualifies from the government perspective, are going to come from. The Ministry of Finance is working on that, and there are a lot of measures that the Minister of Finance spoke about, in particular the $1,500 for those who are in the NIB system. And then our colleague who is here at the head table with us, Minister Robinson Regis, is going to drive a lot of the assistance for those who would fall into the category, who for some reason or the other, as the Prime Minister said, not in accordance with the law, their employers did not register them and make contributions to the NIB. We're going to do the best we can from social development. So very shortly, the Minister of Finance, I think he put out a release today, as Minister Robinson Regis said, he needed 7 days to get that system up and running. Minister Robinson Regis hit the ground running hard already with her ministry to provide assistance. We are going to do everything we possibly can. There were not emergency meetings because the government acts responsibly, but up to Sunday night, groups of us meeting with the Prime Minister to discuss the types of provisions to put in place. What we can afford, as the Prime Minister has very carefully said, we don't have an infinite amount of money, but we are very, very clear what is the prioritization as a state at this point in time, and is to look after our most vulnerable in society.
Could I also add that the Minister of Finance has asked businesses to at least keep people in salary for 4 weeks. He made that specific plea, and we're hoping that most businesses will at least try to do that.
It's a question. I have a question online, and it goes to the Minister of Social Services. Where can Tobago persons go to get assistance?
Okay. First of all, let me just indicate that Tobago persons are just like the rest of us. So I know that they are anxious also, even though they have talked about we and them during this, if some of you have seen the memes. But for Tobago, in terms of their social services, they have an office on Wilson Road, the Habib building. They will have a certain amount of information, but again, we don't want people crowding those offices, and the people must be within those categories that I laid out when I spoke a little earlier. Also, with regard to the children on school feeding, the 2 MPs in Tobago have their 50 food cards that we gave out initially, and then whatever else is afforded to the socially displaced. Well, Tobago doesn't have that issue, but whatever else is afforded is the same that will be afforded in Trinidad. But for the office, it is the Habib building on Wilson Road in Scarborough. That is the office. But we're asking again that people not crowd the offices. That is important. Please do not crowd the offices. And I really would like, if I may, colleague, Minister Cox, I just wanted to take this opportunity, as I got another opportunity to speak, to thank the staff of the Ministry of Social Development and Family Services, because they too have to deal with persons who are quite anxious, and they have been doing a very good job in what is a challenging time. So I want to thank all the staff, from the permanent secretaries to the deputy permanent secretaries and all the divisional heads, and in particular the social welfare officers, who in the main have been doing quite a good job. Thank you very much.
Good morning, Karen Kozier, Philip, TTT News. Just want to verify the 3 additional cases overnight, if they were imported, and also to the Minister of National Security, at what point in time do we engage in a total shutdown? Because we've seen in the Bahamas and we've seen in St. Lucia, they've gone under curfew. Is there a point in numbers when you say, okay, we need to shut this down?
So I'll let the CMO answer the first part.
Yeah, so the first answer is yes. All of them were imported cases.
The government is doing all that it can to protect Trinidad and Tobago. From the day we came out, from the day the Minister of Health came to Cabinet and said the time has come for us to close off, you all would recall the 30th of January, travel from China. We were one of the first in the world to do that. And I really thank God for guiding us, that we have been ahead of the curve of decision making and been decisive based on the great medical expert advice we've been getting. Some countries have taken those decisions because they weren't where we are at. We are not ruling anything out at this stage. We took the decision to close our borders to non-nationals earlier. Some of our Caricom countries told us that's because you don't depend on tourism, and they continue to go longer. You don't know what is presenting in each jurisdiction. We are most concerned about our own. We feel at this stage we've taken the right measures, and it continues to be reviewed on an almost hourly basis by the members of Cabinet who are charged with the responsibility. We are continuing to review, continuing to be in constant contact with health that drives it and drives our decision making, asking for advice. So we're not there yet, but it's fluid. It is very, very fluid. And we require the citizens, all of us, to exercise that social responsibility. And I'd like to thank the members of the media for continuing to get the message out there. Minister Cox, we don't thank Minister Cox enough, but she's one of the first people we reach out on our morning to ask for her to pull things together, the messaging, just trying to rein in everybody and keep everybody within their crease. The Ministry of Communication, people who come and say, it's everybody, the police service, all our frontline health workers. The point is, Karen, we're not there as yet, but this is fluid. And as you've seen, the government will take the decisions we need to, and we will announce them immediately.
Thank you very much, members of the media.
And that's what's trending on COVID-19. Remember, you can keep up to date with all that's happening on TTT, Chalk City 91.1 FM, Suite 100, Next 99.1 FM, as well as TTT Live online. Thank you for viewing this press briefing from the Ministry of Health. I'm DK Rostar.
Speak up.
Speak up.